Oh.
Election.
Sorry.
Election of Vice Chairman.
Yeah, thank you very much. Well, a very good afternoon to everyone, and thank you, Councillor Doe, for kicking off the proceedings and the election of myself as the chairman for the ensuing year. The next item on the agenda is, of course, the election of a vice chairman. And in welcoming everybody to the first meeting of the Health and Wellbeing Board of this municipal year, on the election of the Vice Chairman, it is my understanding that Councillor Howard Doe would be happy to continue undertaking the role of Vice Chairman for the forthcoming year. So without further ado, I would like to nominate Councillor Doe to the position of Vice Chairman of the Board. Is that seconded, please?
Yes, Chairman.
Thank you. Are there any further nominations? Fine. In which case, Councillor Doe, thank you. You are duly elected Vice Chairman of the Board for 2022-2023 municipal year. Thank you. Apologies for absence have been received from Leanne Farage, Director of People, Children and Adult Services, James Williams, Director of Public Health, who is substituted by Dr. David Whiting, the Deputy Director of Public Health, and Paul Bentley, the Accountable Officer in HS Kent and Medway Clinical Commissioning Group, who is substituted by Dame Elaine Sillis. And a very good afternoon to you and welcome to our meeting. And welcome to Medway and this magnificent venue of the St George's Centre. With respects to invited attendees, we have received apologies from Jane Black, who is the Chief Executive for the Medway Foundation Trust, and Helen Greatorex, Chief Executive, Kent and Medway NHS and Social Care Partnership Trust. Are there any further apologies for absence, please? Paula Wilson, thank you. Thank you. And I believe also that Jackie Brown, I was with her earlier this morning, and I understood she was sending her apologies. So if that hasn't reached you, then please take it as apologies given. Oh, yeah, Martin. No? Right. Right, there being no further apologies, the record of the meeting, can I sign the record of the meeting held on the 14th of April 2022 as a correct record, please? Agreed? Thank you. There are no urgent matters to be dealt with as per item agenda 5. Item 6, declarations of disclosable pecuniary interest, please. Any declarations of disclosable pecuniary interest, please? No, thank you. Are there any other significant interests? No. And finally, are there any other interests, please? Good. That's fine. Now on to the main business of the meeting, and as usual, may I ask those introducing reports to keep their introduction to a maximum of 5 minutes, please. Item number 7, COVID-19 Local Outbreak Management Plan Briefing. That is item agenda number 7, COVID-19 Local Outbreak Management Plan Briefing. And I'm happy to pass to Dr. David Whiting, the Deputy Director of Public Health, to say a few words by way of introduction, please. David.
Right, thank you. So I'll just pick out a few key points from the report. Since the last meeting in April, the infection rate in Medway and nationally of COVID has decreased substantially. And this is due to the vaccination program, natural immunity, and increasing understanding of how to manage risk. We have seen a small uptick in numbers in the last couple of weeks, both in terms of symptomatic cases that have been reported and more broadly across the southeast region. From the population-based survey. So there's definitely a small increase that is happening at the moment in the number of cases. And we're seeing a very, very small uptick in the number of cases in a couple of the acute trusts. The modelling suggests that this is not going to increase to become very large, so it's just going to be a small rise and then should level off. So we're not expecting any significant impact on the local system in the foreseeable future. There have been no new variants detected in Medway since the Omicron variant, and there has been no surge testing for variants required in Medway recently. There have been various changes, a few changes to guidance published since the last meeting. So the requirement for employers to explicitly consider COVID-19 risk assessment has been removed, but there is guidance for employers and employers and workplaces living with COVID, living with COVID guidance. A couple of other things to pick up on. So with the vaccination program, Medway continues to make vaccine available for people who are yet to take up their initial vaccine offer through the Evergreen offer. And I think those are probably the key things just to pull out of the report for now. I'm happy to take questions.
Can I ask Chairman a question on the question of the so-called long COVID? Do we know do we have statistics on how that's progressing? In other words, whether there is any sort of reduction in numbers of those that have got it, or whether it's staying fairly stable? I'm thinking because obviously that the effect of COVID in many cases is to actually impact on any what I might call defects you've got, you know, and I don't know whether there's any more that could be done for it, but I just wondered whether you'd like to comment on that aspect.
Okay. Yes, it's a very important aspect. So this is sort of a large ongoing piece of work that lots of people are looking at. And so I don't have any statistics with me at the moment, but it's something I can look into if you would like some further information.
Are you happy with that? So David will take that away and...
yeah, that's fine. Thank you.
Vince, please.
I think Gary indicated first. I'm happy to give way to Gary first.
No, you've got your hand up, Vince. More than happy. I'll come back.
I'll be the sunny politeness in here. That's fabulous. I'm sure it will last all day and for the rest of the next 11 months. David, thank you very much for the update. Just looking at the latest Medway-wide statistics, we are again below national average, England average. So that's a good place to be. I still have a concern around people stepping forward, actually in particular for their third booster jab. I mean, that is substantially lower, just over 40%, certainly in the area I represent and nearby areas. So I guess the message, which again can echo out from this meeting today, is look, it doesn't matter whether you've had your first, your second or no vaccine, the door is open. And we'd really encourage people are going to be going to music festivals, events like the Armed Forces Day, where you bring thousands of people together, and even though they're outdoors, bringing people together is a greater risk than not bringing people together. So I'd strongly encourage anybody watching onto the Health and Wellbeing Board today to make sure you get those vaccines if you haven't already. I'd really welcome some further update on the long COVID, kind of where we are, where the situation is. I know that we've got some provision on a Kent-wide basis, not necessarily Medway specific, so look forward to receiving that. The last thing I'd want to raise, and James and I have had some dialogue on this, and this is around, I guess, the next public health kind of national concern, and that's really on the issue of monkeypox, which of course is not COVID, is substantially different to COVID, but is being portrayed as almost the next pandemic in that sense. It's very different, and certainly when I spoke with James just a few days ago, he was clear we've had no cases in Medway at that point. Some powers have been delegated to him, and I wonder perhaps for the next appropriate Health and Wellbeing Board, where there is an update, whether that's just a paper or an actual full report, that might be helpful. I know certainly on social media people are asking questions, But it's worth saying it's a very different situation, and certainly in the last few days when I spoke to the Director of Public Health, we had no cases in Medway, and that's a good place, and we want to try and stay that way as much as we can. Thank you.
Yes, we'd be very happy to produce a report on that for the next meeting. Yes, that's a good idea.
Gary, please, and then Adrian.
Thank you, Chairman. Thank you, David, for your report. Two questions, please, and one's going to slightly follow on from my colleague Vince across the road there. On page 19 of the report, 2.2, main changes living safely with COVID-19 post 1st of April 2022. 2.2.2 and 2.2.3 of where employers explicitly consider COVID-19 their risk assessment has now been removed following on the current guidance on domestic voluntary status certification as is recommended as for the NHS COVID pass. So the question is, seeing this restriction has now been removed, when are we going to get back to face-to-face meetings with our GP? Because if these restrictions have been moved, I see absolutely no reason why those restrictions should continue. And my second question also refers to the vaccination programme, where we go on page 20 and it states within 2.4.2 that the extremely vulnerable individuals will get an additional booster jab. Now, when I say additional, it was portrayed in the middle of last year that a third booster jab will be given to the general public. But this would not be for those who are clinically vulnerable. They would have a standard, not a booster, but a standard third jab with a fourth one to come in the latter part of last year or the early part of this year. That has not occurred. And I'm aware of a number of individuals where they've tried to book this or find out what's happening using the NHS app, but unfortunately the app is designed that it doesn't recognise a fourth jab or a third booster in some cases. So I'd really like to know and understand what is occurring there. Thank you.
Okay, so several parts there. The issue around the booster jab and the app, etc., I'm going to have to come back to you on because I haven't tried to interact with the app in that way, so I can't comment on that. With regards to the guidance changes, can you remind me again of the question around the guidance?
The rationale around the guidance is within the report saying that restrictions have now been removed. So I'm asking why we still have restrictions in residents trying to get a face-to-face appointment with a GP.
Okay, I'm going to have to come back to you on that one as well, I'm afraid.
Okay, then the last point really is in terms of those booster jabs, which for the normal resident they had a third booster jab, but for the clinically vulnerable, those are cancer patients and others, they were told that the third jab was not a booster. That would be a standard jab, and they would get a booster in the latter part of last year or early part of this year, and that hasn't occurred.
Can I be helpful, Chairman? I know that certainly in the area of South Raydham and Parkwood and so on, we've certainly had that. And, you know, a whole load of people were lining up for that fourth jab, and they're doing it very well in the sense that what they've now done is to make sure that you get all sources of the injection. So you've got the Pfizer one, you've got the AstraZeneca, and you've got the Moderna one as well. So, you know, they're giving, certainly in that area it seems to be working. There may well be areas where it isn't, and this is where I think we need to just investigate and make sure that everybody knows how to get, that there is that jab available for that particular group, or those groups, and secondly, that, you know, the time for doing them. I mean, some GPs don't want to do it. I know, they're too busy. But we have to find a way to get that done, because I think that otherwise the cost to the health system will be very much greater.
Thank you.
I hadn't forgotten you, Adrian, but on this same theme, if I may, it is rather worrying because and I share your concerns, Gary, because if you look at paragraph 2.4.5, it says approximately 15 million and 40 million people have had a second dose and a booster, respectively. And then in Medway, just over 205,000 have had the first dose, and then 194, nearly 195,000 with the second dose. And then there's 150,000 received their first, second and booster doses respectively. Now, when I look at those figures, I would have thought that they would have been progressive, but they're all over the place, which indicates that people have either had the first vaccination and have not gone back for the second, or they've had the first two and haven't gone back for the booster. And it seems to be all over the place. And I share your concerns that I'm one of the fortunate ones, I suppose. I say fortunate. I've just been watching the way things go, and I had my first vaccination, the second vaccination, first booster, and thanks to Tracy Crouch and her pensioners forum that she organised back in April, I was able to have my second booster. There was nobody in the queue. Come along, come and join us. And lots of people who were vulnerable available for the second booster. They had all of the records there. The staff could actually track people back, and as long as you could prove who you were, they would give you the booster vaccination. So I'm bang up to date. So
But,
to me,
more,
there should be no reason why any of us should be like that.
important, Chairman, there are a number of my elderly residents who are still sheltering because they still believe they're entitled to a booster that should have occurred last year. They've not been notified of when that's going to take place, and when they go using the NHS app, which they are directed to do so when they try to apply for it, that too is incoherent in terms of the way that they get it. So, as my good friend here, Councillor Doe, has just said, within his area, that may be successful. But in the majority of Strood Rural, Peninsula, Strood North, Strood South, that is just not occurring.
I'm conscious that Adrian wanted to speak, but did you want to come back on this particular point?
Yes,
Please,
I do,
thank you.
if that will be
Dan.
helpful.
Thank you,
because so I'm brand new in post, but yesterday I did meet with Kent and Medway's vaccination lead, and we would expect that actually not just have people had the boosters, but actually people also should be having their invited for their spring booster this year. So for some people who are clinically vulnerable, that means that actually they should have had 5. Now, we do know that that is rolling out in some parts. So we'd just, now you've said Strood North and South, I shall go back to the team tomorrow.
And Strood Rural and Peninsula.
And Peninsula, okay. And find out what the problem is. It is true to say that last year, when the booster for the clinically vulnerable became the 3rd dose, it was very confusing, I think, for everybody, including those running the vaccination centres and including members of the public, as to what they were or not going to get. It's exactly the same boost, it's exactly the same vaccine, but it's what it was classed as. So if you leave it with me, I will go back to the team tomorrow and I will ask them to pick up around this particular area.
Thank you very much. If that can come back to the whole group, I think that would be appreciated. Thank you.
Yep, of course.
Might I suggest that as this is the Medway Health and Wellbeing Board, if it's not too much trouble and information is available, I think that would be useful to have this for across Medway, please, if that is possible. That would be very useful for us as a Health and Wellbeing Board. Thank you very much for that. Adrian Golding, please.
Thank you, Chair. Just follow on the vaccination issue. Certainly, as in Walderslade, they are rolling out the second booster, because my wife had it about 3 or 4 weeks ago, and that was done via our local GP surgery, using the Lawswood Healthy Living Centre as the location. So it does appear to be patchy. So certainly, I've got no complaints because my wife, who also suffers from type 2 diabetes, obviously went into the slightly vulnerable category. This is a good report, tells us where we are, and I think, David, it all seems fairly positive, I've got to say. I'm going to just, if I may crave your indulgence, Chair, just widen this out just slightly in saying that it would be good to have an opportunity to have a discussion and a report fairly soon on what are the longer term lessons that we can learn from all this. And I think now we're pretty well through it, albeit there are a few bits and pieces, you know, the beast is still lurking, and we can't be absolutely complacent about it, but I think it has got to the stage where we can look at the lessons and what we could say to government as to suggestions of where we can make suggestions. Certainly from my non-professional view, I think locally here we manage fairly well, but I think there's lessons to be learned that I think, certainly when it came to things like track and trace, there should have been a greater use of local resources. Trying to run everything from Whitehall, let alone Downing Street, and that sort of, I think there's a lesson to be learned there. It just does not work. And track and trace was a classic example of that, that when it was actually devolved down to the people on the ground who knew their local areas, it actually performed much, much better. And I think for the health service itself, there's lessons to be learned. Whilst there was brilliant work done by the frontline staff, and one just cannot praise them enough, there were other aspects of the health service response that was not so good, particularly on the provision of PPE. The government got the stick for all the problems with PPE, but it beggars belief that the government actually had to get involved in that in the first place. There should have been robust frameworks in place that could have been scaled up, you know, with the flexibility of supply. So there's lessons to be learned there for the future. And again, I think local is the key, but all perhaps not in small units, but certainly the way the latest reforms have gone, they give a sufficient footprint in Kent and Medway to make a Kent and Medway-based procurement system for these sort of supplies to be more than viable, and not having to eventually rely on the armed forces to move the stuff around. I mean that was not a good thing at all. So I think there are lots of lessons we can learn. We have this discussion. So perhaps you put that into the programme sometime in the future, Chairman, because I believe there is going to be some national report done, and I think it would be good if here in Medway we were on the front foot and had our ideas and our suggestions to that inquiry ready to go. Thank you, Chair.
Would you like to comment?
Yes, so you're absolutely right. Yes, there is going to be a national report on this. So I guess it is worth us preparing. We just need to make sure we don't sort of duplicate effort. Yeah.
Vince, please. Oh, sorry.
Stuart was definitely first.
Yes, Stuart, sorry, Stuart, you're next and then followed by Vince. Thank you, Vince.
Oh, we're all so polite today. This is lovely. Thank you. I was just a very quick point. My colleague, Councillor Etheridge's question about face-to-face appointments with the local doctor. In my ward, of course, they would be really excited to have any kind of appointment with a doctor at any time. So I'm envious already. But I'm just surprised we don't... I'm glad that Dr. Whiting's going to take that away, but I'm just a little surprised, Chairman, we don't have someone, an expert here, that could answer that immediately. And if not, why not?
David, do you have an answer, please?
We'll do a bit of a double take. I think it's not unreasonable at all to be asking the questions about why some provisions can't get back to normal in relation to, for example, GP practices and face-to-face consultations. After all, we're all users of GP services as well. I'll take it that the thing with GPs is they are their own sort of managers. You know, they manage their own, you know, GPs are independent practitioners. There is national guidance and policy. I think in terms of having it may very well be sensible for the next meeting, potentially, to have someone who represents the primary care network to actually come and have a conversation with yourselves as to what challenges have primary care faced during the pandemic and what they're doing. Because like all sort of services, public and private services, there were good things that came out of the pandemic, however difficult it was for us all in relation to the way some things have transformed. And there are some pretty bad things that came out of it. And, you know, the public inquiry, the inquiry will identify whether there has been harm and what lessons are to be learned. But I think the primary care networks probably would be sensible to come. And because they're local, representing local GP practices in a network. And I think they would be the individuals that would be best placed for you to have a conversation with.
Chair, can I come back briefly on that? Thank you. Thank you very much. I wasn't trying to put you on the spot because I think that's the answer I was expecting that would be given. I think it is a more general comment, Chairman, that I'm disappointed that sometimes we do not have representatives from all the various aspects of those that provide health services to Medway people at this board. And I think that is a shame, and I just hope that could be noted to see what can be done, to see how we can improve that situation, because I expected there should be someone here from the primary care network. Thank you, Chair.
Thank you, Stuart. Before I ask David to comment, the one point I would make, and that is that successive meetings, this particular point has been raised at the Medway Health and Wellbeing Board. And you're representing Paul Bentley today, and I was, for the life of me, I'm trying to think who it was that was in Paul's position before he took on the role. Somebody will help me, I'm sure. But he, whoever he was, together with Martin Riley, the two of them undertook and gave a commitment to this Overview and Scrutiny Committee to actually go back and sort out and come back and inform this board what the strategy was relative to GPs across the whole of Kent, but particularly in Medway, and what was the future. We wanted to know what the strategy, because this is not an Overview and Scrutiny Committee where different questions are asked of different people at a scrutiny committee. This is the Health and Wellbeing Board, and we look at the strategy. And we wanted to know what the Kent Medway strategy was, the bigger picture, and how did Medway fit into the picture, and what information could be given. On 3 successive meetings, these two gentlemen, one on that side of the table and one on that side of the table, said that they would take this away, put the answer together and report back. I hate to say this, and I would like this recorded in the minutes, please, that the CCG and Martin Riley, representing the MCH, have failed to provide the information in a timely fashion to the Medway Health and Wellbeing Board, and we would like this corrected for the next meeting, please.
Okay, thank you.
Sorry to use you as the messenger.
It's only day 8, so that's perfectly fine. So I think the CCG formally closes down on the 30th of June, and the IPB comes into being on the 1st of July. I'll commit to going back to Paul Bentley and saying that actually you request at your next meeting a presentation on where we are with primary care, very specific to Medway. And I will report back to Debbie progress on that, as well as vaccinations, so that she could share it round.
Yeah.
Okay?
Thank you very much for that, Dame Eileen. David, would you like? Beg your pardon, Vince, sorry.
Yeah, thanks. I mean, my recollection is that I think when Stuart originally raised this here, Williams, and you're welcome, and Martin Riley gave a kind of impromptu immediate response. I seem to recall we did have an item at the following meeting, but it may have been low on detail. I note in the work programme we've got an item coming to the November meeting. I note with very positive interest we have a task group, a cross-party member task group looking at this. So I think there is plenty of focus, but I think we can't overemphasise this enough. This is a massive issue. It's filling our inboxes. To be fair to GPs across Medway and across the country, they were given a clear directive by the Department of Health prior to COVID to move a proportion of their appointments to online. That was happening anyway. There's two issues, isn't there? Issue number one, having any sort of appointment, and I think, you know, people like Councillor Chris Buckwell, if he was here, he would say actually his surgery, you can pretty much get an appointment the same day or the following day. Other places, that's not the case. So it's actually the inconsistency, which is one of the big challenges. You know, if you had actually everybody across Medway struggling to get a GP appointment, that would be terrible. But in a bizarre sort of way, it's probably more terrible that some people aren't having that experience because of the postcode lottery of where their GP surgery is. So whether the November report moves to the next meeting, whether, you know, that will be sorted out elsewhere. But I think from a Medway Council perspective, absolutely that's been looked at. But I just wanted to make that point around GPs being told, you know, it's a directive from Department of Health, move some appointments, and colleagues here will have greater detail on that. And that was before COVID. And of course, things had to change during COVID. On the reason I wanted to just come back in before we close this item, there is a fundamental difference between residents across Medway who are desperate to get their third or indeed fourth vaccination and can't access it, and those who just are choosing not to go. And the stats will, you know, I suspect in a bizarre sort of way, the stats between my ward, which is one of the most urban wards, if not the most urban ward in Medway, and Gary's ward, which is a real good mix of urban and rural, predominantly rural. Actually, the numbers probably won't be that far apart, but it's the rationale as to why are people missing. And I think in the case of some parts of Medway, it will just be the ability to access, and in other parts of Medway, it will be the refuse. And no one's being forced. This is not compulsion. However much that may have been a sensible public health national move potentially, but of course there's a lot of kind of issues with that. But so that's, I guess, my slight concern about coming up with a list of 22 lots of percentages, which is what we'd probably get, that's the stats, is that actually it's what lies behind that. We might have an instinct that some parts of the community it's because people aren't going, in other parts of the community it's because they can't access the appointments, or the GPs aren't just available to have a conversation with to get that vaccine. So I guess that would be, and again, if there is analysis, information, if there's been research done in the community to say actually why aren't people stepping forward in certain communities, is it, and there's a lot of reasons why, you know, anecdotally things have been shared on that as to why people haven't stepped forward, from, you know, all of the different stuff. They believe the internet, they believe something else, whatever it might be. So I'd ask if as much of that is possible, that can be added to the kind of raw data of saying these are the percentages of people. My final point is actually following up on Stuart's helpful contribution actually around attendance. One of the issues with long COVID, I think, as well as the kind of physical issues around long COVID, is the mental health issues. And it's regrettable that for, I think, not the first meeting, there's no representative, either the named representative or a substitute that we've had in the past from KMPT here, because again, I'd value to hear their view actually as to, from their perspective, have they had to change services, you know, alter services in light of particularly that kind of long COVID impact on mental health, rather than obviously lots of the things that have been shared around physical health with respiratory issues and all the rest of it. So thank you.
Thank you. Thank you, Vince. It was not my intention to speak on this subject, but we seem to have introduced an awful lot into the COVID report. But I will mention to you and to the meeting, reference your concerns over those people who are absent today rather than those present, that this is something that I was very mindful of when I saw the apologies list, and I'm going to make it my duty to speak with the leader of the council on his return from holiday, together with the chief executive, and express concern that this Health and Wellbeing Board is not being treated with the respect that it should be treated, particularly as we're talking about and looking at the strategy of health and wellbeing for the people of Medway. And my request to those gentlemen, when in speaking with them, is that pressure be brought to bear to ensure that those that should be here, and they have a duty to be here to speak about what is happening for the people of Medway. And that is what we are here to do ourselves, the health and well-being of the people of Medway. So I'm going to be taking that matter up. As you've raised it, I thought it appropriate to give you and the rest of the board an answer. So thank you. Gary, is this a quick one before we go to David?
It is, Chairman, a very quick one. And if you think it appropriate in 6.1, the recommendations, what you've already mentioned about the people who should be here, why aren't they here? But more importantly, the information that's just been imparted to us today, that those who are clinically vulnerable should have had by now 5 vaccinations. And therefore, you know, the number of people who are still on 3 are waiting their 4th, and my colleague just to the right of me who said his wife has only just had her 2nd. So really, somehow that needs to be incorporated within the recommendation that everybody is brought up to date as quickly as possible.
I think it's probably important to say offered, because we can't instruct anybody to have
I fully appreciate that, but
vaccine.
For that information of offered of 5, that is absolutely brand new news to me today.
No, you're right actually to offer, and for those who actually take up the offer is something totally different. I agree with you.
I think it's probably important just to make sure I've got it completely right. And I will share that I am a clinically extremely vulnerable person, so I've had my 5th jab. So, and as a patient, I've known how to navigate the system as you have to do to be able to proactively go out and seek. But there are some text messages flowing around the system at the moment. So actually, I have myself also received a follow-up check. So whether there's also another drive now to make people aware and things, but just to make sure I haven't got it completely off the wall, Dr. Whiting, just check.
So I was just going to come back on the problem that you were talking about earlier, where people were having trouble using the app to find out how they can get a vaccine booster or additional dose. So you don't even need to use the app. You can just go onto the web, onto nhs.uk, and there is Find a Walk-in Centre for coronavirus vaccinations. And I just entered just now MB4 40R, which is the postcode for Gun Wharf. And then there are 3 sites that have come up immediately within just over a mile of that postcode. So I can show you the website address after the meeting if you like, and you can...
that would be perfect, thank you very much. But once again, people use and have been told to use the app, and they don't use anything else. So once again, it's that marketing of that information is just not occurring.
Can I now turn to the Vice Chairman, please?
Thank you. First of all, I'll move that the report is noted, together with the comments under the reports that have been asked for, namely the one into long COVID, where we are with that, which I think would be helpful from David Whiting, and the further reports we've requested on the GP provision, and also on the access to the vaccinations, which both as to how it's performing, and are we satisfied really that everybody knows what they. We need to assure that that everybody knows how to get it, whether they're computer literate or whether they're not computer literate. It's just important that their health comes first. So with those additions, Chairman, may I move that recommendation, which is that we note the report.
Thank you. Is that agreed? Agreed. Thank you all very much.
Right.
The next item is item 8 on the agenda, Medway Safeguarding Children Partnership, and it's the update report, please. We have Claire Bright with us, who is Associate Director, Adult and Children Safeguarding, and the Kent and Medway CCG, and Rebecca Cooper, Head of Safeguarding and Quality Assurance, who are here with us today. May I now hand over to Becky to introduce the report, please. Thank you.
Thank you, Chairman. So this is one of 2 reports a year that comes to this Health and Wellbeing Board from the Medway Safeguarding Children Partnership. And it's important to note that this report is to provide an update on the work of the MSCP and to present the MSCP's strategic plan and business plan. The MSCP annual report will be presented later in the year to the board and will specifically include an update from the MSCP independent scrutineer. So you'll be aware that there are 3 statutory partners who make up the MSCP, and Medway, and these are Medway Council, Kent Police, and the Kent and Medway Clinical Commissioning Group. Paula Wilkins, who is the current Chief Nurse at the CCG, is the current Chair of the MSCP Executive. She's our outgoing Chair, and we welcome today our incoming Chair, Dame Eileen Sills, and we're very glad that she can be with us today in her capacity. We also have Dr. Leanne Farrak, who is the Director of People for Medway Council, and Detective Chief Superintendent Emma Banks, both whom send their apologies today, Chairman. The MSCP has set five priorities in its strategic plan that you will have had sight of, which are both attached as appendices, and we have detailed within the report the activity that will take place under each of the priorities, those being effective partnerships, contextual safeguarding and trauma-informed practice, domestic abuse, neglect, and effective early help. And we also want to note that in 2022 we will be adding a sixth priority, which is violence against women and girls and sexually harmful behaviour.
Good.
And this sits alongside the Kent Police strategy for 2021 through 2024, tackling violence against women and girls. A key focus of the work of the MSCP over the last 6 months has been around undertaking learning reviews. These are both statutory cases where there have been a serious safeguarding incident. These include rapid reviews and local safeguarding practice reviews, but also learning reviews that include learning lessons reviews, where agencies together have identified other cases where there is potential for learning. And we include good practice as well within these. The MSCP independent scrutineer, that's Rory Patterson, has also been looking at how the partnership responds to learning from case reviews, which you have read in the report. Mm-hmm. One of the main areas where the MSCP is able to influence the multi-agency work is through the training that is delivered to practitioners across Medway. And the MSCP are now running both face-to-face and online virtual training for slightly shorter courses, as well as a whole suite of e-learning. I'd like to take any questions and will be assisted by Claire Bright. Thank you.
Thank you very much. Members, Gary, please.
Thank you, Chairman, and thank you very much for your report. A couple of questions, if I may. On page 27, we start off on 3.11, multi-agency safeguarding training. Now, back in December 2020, Medway Council had a voluntary sector task group including various aspects of third-party support and the MVA. And I'm just wondering if you actually contacted Medway Council to see if any of those members of that task group or the MVA were included within your safeguarding training. So that's question number one. Number two is on the, in fact, it's exactly the same question for 3.12 and 3.13 in terms of neglect. Then going on to the main body of your report on your RAG status, it says under red, work is significantly behind schedule and no progress has been made, and or progress has been made, but the time scale has not been achieved. Now, going through that report and looking at the timescales on a number of ambers, to my way of thinking, they should in fact be red. Your comments on that, please. Thank you.
Thank you.
Well done.
Are you happy for me to respond to those questions, Chair? Yeah. So in relation to the contacting the Medway Voluntary Agency, I know that Simon Plummer, the business manager for the MSCP, has indeed been in contact with the voluntary agency. Forgive me, Councillor Etheridge, I can't remember the lady's name who's the chair of the Medway Voluntary Agency Association. Thank you, Jane Howard. And I know that Simon Plummer has been in contact and had regular conversations with Jane. I can't comment on how many people from the voluntary agency have attended any of our training, but that would be information that could be included in the annual report, which will be a more detailed response.
That would be appreciated. Thank you.
I'll make a note to mention that to Simon Plummer to respond. You asked a question about neglect, referencing 3.12 and 3.13, and I just want...
Exactly the same question.
Okay, thank you. And may I ask you just to refer to me, sorry, I was just scribbling down the question, the specific question to the Reds, if you could just point me to which number?
For instance, on the RAG status, sorry, it's not coming up. So on the RAG status, what RED stands for, and then we go immediately into 1.1.1. Launch event planned for the 13th of June 2022, and that's yellow. That, in fact, should be red. And there are a number of other occasions similar to that.
I'll take those back to the business manager and get those amended for the purpose of the annual report and provide an update, if that's okay, Councillor Etheridge.
Thank you very much.
Thank you.
Sorry, Gary, we didn't really hear the questions that you were putting there, reference on page 35, the RAG ratings. Could you, for those that didn't pick it up, could you go...
Sorry, on the RAG status, red signifies work is significantly behind schedule and no progress has been made, and or progress has been made, but the timescale has not been achieved. I'm referring to all those amber ones where the timescale has not been achieved, and therefore, to my way of thinking, they actually should be red. Thank you.
Forgive me coming back to you on this, but my understanding on there, these are the indicators. If you look at page 35, work is significantly behind schedule, that indicates red. If progress is being made, it's amber, and where action is being done as completed is green. And then when you read through the report, you see that there are several items that are at amber. 1.1.1, for example, on page 36. It's
sorry, Chairman, but they do not meet with the RAG status as it states here quite clearly. Progress has been made, but the timescale has not been achieved. That's what it says quite categorically. And therefore, if that's the case, then they should be red.
Do you think we could just come, would it be helpful for us to come in on this?
Yeah, sorry, Donna, you wanted to come in, please? Thank you,
I think that RAG rating system is what we'd ordinarily use, so that's showing that works in progress at the moment. So that could have already started. If you look at 1.1, for example, it's saying the Section 11 audit process to be developed. So that work is in progress, that's showing. And the launch event, these papers might have come out, I can't talk for the actual detail, but these papers might have come out to here, and that work might be underway, if that makes sense. So I think you'll get, at a point in time, some things will look like they're not in date because the work's already progressing. That might have been completed since we're sitting here now, from when the papers came out to the board.
Thank you for your answer, and I fully appreciate that. And therefore, the RAG status needs to be amended accordingly for that information to be simulated in a, dare I say, in a more appropriate way.
Because this is the, I can see what you're saying, it does make sense, but this would have been the April update plan. So at that moment in time, the things that are showing as June would have been looking still amber, if that makes sense. We're looking back in time on the papers, because this is a moment in time now, rather than an updated plan today.
And once again, I fully appreciate what you're saying, but we're reading these papers to say this is what's occurring. If necessary for your own good selves, a summary is produced to say these have now moved on and that's the current status, then that's appropriate, I think.
I'm gonna come in here actually, Gary, and say that I think that a commitment has been made that this will be taken away and will be reviewed, but it also ought to be remembered that we're looking at the strategy of the Medway safeguarding, and this is a draft of V.7, whatever V might mean, of April 2022, and this also needs to go before the Overview and Scrutiny Committee, and that is something that we are not. We're looking at the strategy, so I think if the commitment's been made, please to look at the red, amber and green to make sure that they're significant, then this can then go forward to the Overview and Scrutiny Committee in the appropriate way. Donna, you wanted to come in on that?
And just to note, Councillor, that it is subject to a lot of ongoing scrutiny, so those dates would be being reviewed anyway, and probably have been since this moment in time report. So we can absolutely assure you of that and make sure it's going through the proper routes as well, so that the council's getting access to that.
Thank you. Vince, you wanted to come in, please?
Yeah, thank you very much, and thanks for the helpful update report. It's always good to see these things coming as they happen throughout the year, and really welcome the fact that there will eventually be a priority 6 on ending violence against women and girls. I know certainly my colleague, Councillor Zoe Van Dyke, has been doing some community work on this and has been hearing some pretty concerning views of the public on this. So I think more that can be done, focusing both in this report but elsewhere, is important. I've got kind of 3 practical questions, really, more than anything else. In priority 1, it talks about developing the opportunity to work with wider groups of children and young people to support the work of the partnership. I wanted to get a sense of feeling, because I think that can be quite a challenge sometimes. We have 2 or 3 quite matured groups within the Medway kind of structure. So we have the Youth Council, we have the Young Carers, but actually there's probably about 65,000 young people that aren't in those other groups. So how do we ensure, for something as important as safeguarding, that their voices are being heard? Secondly, on the issue of domestic abuse, certainly Medway Council's accreditation with White Ribbon is due for renewal in the next quarter after next. And of course, Kent Police, I think, have that accreditation. I'm not sure whether NHS partners in Medway do or not. So if they haven't, I'd really encourage them to think about becoming White Ribbon accredited. And of course, we've got changing some of those organisations in a couple of weeks' time. And then just finally, some feedback on priority 4, and that's around the fact that neglect can take many forms, and we are in the middle of a cost of living crisis, which is impacting probably more families than I've ever seen, certainly families who are in work, certainly families who perhaps haven't had to access support and may feel a level of shame. And if people are watching today, look, if you need support, those structures are there. I'd encourage people to reach out. Don't suffer in silence. But the potential impacts around neglect and cost of living crisis, is that being, because it's not of course it's not explicit in the kind of work programme and the items covered in the appendices. So is there a specific kind of route of dialogue happening around that at the moment, either explicitly as to how does cost of living impact on neglect explicitly, or building in to the conversations which are already ongoing? Thank you very much.
Thank you. So I'm going to take your first and third question, and my colleague Claire will answer the second. So in relation to how we working with wider groups, we are very fortunate in Medway to have a number of groups of young people that we can access. As you know, we have worked hard to become child-friendly Medway, and the team at Child-Friendly Medway have pulled together hundreds of children and young people across Medway, which is, has been incredibly helpful, and that's certainly fed into some of our work, and we've worked in partnership with Amy St. Louis and her team. But we also have access to lots of other groups of children and young people, whether that's children who are in care in Medway, whether or not that's a range of children in need, whether that's through our wonderful youth services, who again we have access with, and we also work in partnership with the Young Lives Foundation. So we have opportunity to seek the views and gain the voices of children and young people across Medway in a whole variety of forums. And I think we would just say we welcome that opportunity. We want to make sure that's as broad as possible, and that we're also reaching a diverse group of children and young people, and that's really important to us. So I hope that answers that question. Also wanted to pick up on your reference to Priority 6 and the great work that some of, I was watching the overview and scrutiny panel earlier in the week, and there was reference to the Labour ladies doing some great work, and certainly we've made an undertaken to get in contact with them around the feedback from their surveys and their conversations to really help to shape Priority 6 for the partnership. So we again welcome that. If I could move on to your third question, which was around Priority 4, neglect. The Safeguarding Children Partnership have named this to be the year of neglect, and I don't say that lightly, because that absolutely links in with the challenges of the cost of living. And we very recently held what we called a neglect conference, which was for all partner agencies across Medway. We had just shy of 200 people attend that conference virtually. And the cost of living was something that was discussed, debated, influenced the conversation. We had various updates from a whole range of partner agencies. And yes, that is a very live dialogue, whether that's within the Safeguarding Children Partnership as part of the strategy, but also on the front line for workers, for social workers who are dealing with this day in, day out, and are seeing this as an additional risk factor for children and families. So yes, that is currently very live and being talked about. I'm going to pass to my colleague Claire, if I may, for the second question.
Just to respond. Ribbon. Sorry, Claire. That's it. Yeah. Okay, that's good, isn't it? That was my icebreaker, Councillor. So with regard to the white ribbon, I will confirm affiliation. I understand that we are through the board, but I'm very happy, and I will take that back through my new exec as well. In relation to the domestic abuse, clearly this is a very concerning matter across all of Kent, and especially in Medway. In relation to services provided, you may well be aware that the CCG actually commissions the domestic independent, the hospital independent domestic abuse advisors that sit in the acute settings and actually do outreach work across. So there is a commitment, a complete commitment from the commissioning board and indeed our commission services to continue to work towards the cessation of domestic violence.
Thank you very much. Those are really detailed and helpful answers. I look forward to that confirmation. And it's good to hear that nearly 200 professionals and others across Medway have come forward on that. If that was recorded and if it's appropriate, if that could be shared with board members, that would be really, I would certainly spend my time to hear firsthand. That would be valuable, because neglect is something which I think all members of this board and actually all people in Medway would want to see all of us doing. Now, I appreciate it may, again, I don't know the circumstances, so it may be that that's, for whatever reason, may not be appropriate. But if it is, I certainly, for one, would value that. I'm sure other members would as well.
I will need to confirm that, because on the day there were some technology problems. We were doing work in breakout groups. You'll probably be familiar with that, and that at points caused the system to not work so well with so many people being online. But if it was recorded, which I'll confirm, I'll get that information back to Debbie and we'll circulate where that's available.
I think it was Adrian, you wanted to come in, please?
Yes, thank you, Chair. Very interesting report, and it's interesting to note the aims of the MSCP are almost identical to that of the Community Safety Partnership, which I chair, and so it's good to see. We have done a lot of work on the CSP already, particularly against on the subject of violence against women and girls, for instance. I'm pleased to see that's now coming as your sixth priority. In fact, so much so that this work has been undertaken by the Medway Task Force, which is led by Sharon Adley. I think it'd be good if you could get in contact with Sharon and talk to her, because Sharon bid for Safer Streets funding, and I know that we've already, through Sharon, put in another bid for further Safer Streets funding, and that is all directed at safety to prevent violence against women and girls. It's a subject we take very seriously, but having said that, we've got to put this into context, and I think it's very important to put it into context. When we had our CSP annual survey, which reached not a huge number, but just under 700 individuals in Medway, the majority of the respondents were female. When they were asked out of a list of some 20 possible concerns of safety here in Medway, violence against women and girls actually came something like 12th or 13th out of that list. You know, and there was some surprising things that one would consider quite minor, actually, out of that survey came much, much higher up the list. So I think we've got to put it into some sort of perspective and context, because certainly whilst we're very, very keen to keep Medway a safe place, that is, it's my firm belief that by and large Medway is a safe place, but we've got to make sure not only we keep it safe, but make it safer. And I'm particularly concerned that it's in some cases people are trying to over-egg the thing, and that I think is counterproductive, because a lot of these things are perception, and if people keep saying, oh, maybe it's not safe, then people believe it then to be true, which is not true. We're the largest urban area outside of London in the southeast of England. We do have our challenges. We can't get away that we have significant challenges, but we're up for meeting them. And I think the partners, and this is a report really all about the partners, and I share the same partners as you, the police, the CCG, on the Community Safety Partnerships. And I think the partners do a good job, and Medway is safe, but the thing is we've got to keep it safe. Thank you, Chair.
Did you want to come back on?
Yes, please, if I may. Thank you. So you'll be pleased to know that we have been in contact with Sharon Addy. And Sharon actually recently spoke at my own service meeting in Safeguarding and Quality Assurance and did a whole presentation on the Safer Streets campaign, which we were very signed up to. So I know that following that, Simon Plummer's had that contact with Sharon, and certainly she'll be a key LinkedIn partner for that particular priority. Obviously, I haven't seen the response to your CSP survey, and it's great that you had 700 people, but we've done surveys too with our children and young people, and Child Friendly Medway, right at the very beginning of their birth, if you like, did a survey, and actually children and young people were telling us that they didn't feel safe. And so I think we have to get into the balance that we need to reach as many people as possible to get that feedback so that we can help all people, but particularly women and girls across Medway, to feel safe, whatever that looks like, whether that's to do with street lighting, walking home alone, alleyways, you know, parks, places and spaces. Those sorts of things often come up as features. And of course, not forgetting a big issue around misogyny, and that being something that's a real challenge for women and girls. And we can't lose sight of that when we're thinking about violence against women and girls. Thank you.
Stuart, please.
Thank you, Chair. I'll be quite brief. I'm going to say something positive. Yeah, I've read this report, listened carefully to what you've said, and bearing in mind our involvement here is at a strategic level, I just wanted to say I feel very confident that the right people are involved, also very importantly at the right level. I'm also confident that they take it very seriously, and that you identified the correct broad strategic objectives. This is one of those journeys we will never get to the end of, and I'm sure over time it will be amended and changed, and other priorities will come up and some will go down. But I just wanted to say formally, Chair, I'm impressed with what's happening and look forward to seeing it progress. It will be scrutinised elsewhere, quite rightly, but thank you very much.
As that was all positive, I think you can take that as it stands. Thank you very much. Thank you, Stuart. Gary, and I'm going to make Gary the last contributor on this item, please.
Thank you, Chairman. I'm coming back to the domestic abuse question. In terms of Medway Council, we have a policy regarding domestic abuse, and it basically says that if you are in immediate danger, you need to leave your home. Contact a number of numbers, either during the day, prime time, or overnight. There's a number given. And I fully appreciate you're not going to be able to give me the answer now, but I would really love to know how Medway Council's response is to all this. It confirms our policy is working.
So I think it's important to know that that would be a council response, and actually the Kent and Medway domestic abuse strategy is owned within public health. So I would suggest that to get a council response, we would need to have the right person to respond to that, and that may well be James Williams. In terms of the partnership response, that's slightly different because that's the responses from the police, from Children's Services, and from our health colleagues. And so from a Children's Services perspective, we're responding 24/7 to domestic abuse because we have our own daytime services when we have our own out-of-hours service, which also responds to children, young people and families in crisis. Health will have a different response time, and of course the police will again be 24-hour response times. But the council response, as in how you've referenced our services that are advertised on the council website, I think we would want something specific around domestic abuse from a council perspective, just so I don't blur the boundaries of our role and the council's responsibilities, which is slightly different. I hope that's okay.
Thank you very much, and I'll now redirect the question to James Williams. Thank you.
Thank you.
Well, thank you all very much for your contributions on this particular subject. I think that safeguarding, children partnership, domestic abuse is certainly an issue that has been raised. And for me personally, having served as a magistrate in Medway, for me it's been extremely interesting to watch the way safeguarding and the way domestic abuse has been tackled, the way the whole thing has opened up and has been developed over several years now to where we are today. And I'm so pleased that where we are today, and I know that there's a lot more that's going to come out, because every day something new comes in. Every day something has to be examined, and is it or will it form part of the strategy that we are adopting here in Medway? So well done to all of those associated with this work. It's a good job being well done. So thank you for that. So I'm now going to turn to the Vice Chairman, please.
Okay, well, I'll formally move that we note the contents of the update report, the strategic plan for 22-23 and the draft business plan for 21 to 23, and taking account of the comments that have been made during the debate.
Is that agreed? Right, thank you very much. Right, the next agenda item is item 9, Medway Health and Wellbeing Survey, and that is going to be presented by Dr. David Whiting, please, who will introduce the report. David, please.
Right, thank you. So this is something that we've been working on for some time in public health, and James and I both referred to it over the last 2 or 3 meetings. So a lot of the key outcome indicators that we have regarding health and well-being for Medway come from national surveys, and these are designed to provide robust estimates at a national level and at local authority level. So it's possible to see what's happening around the country. They're rarely done with sufficient numbers to be able to provide detail within a local authority. So, for example, from these surveys, we know the prevalence of smoking for Medway, but we're not able to say what the prevalence of smoking is in one part of Medway compared to another part of Medway. So for quite some time now, the last 5, 6, maybe 7 years, I've been thinking about wanting to do a proper population-based survey in Medway of health and well-being so we can answer those sorts of questions. So we finally had the ability to get started with this, partly because for the last 2 years we've had a dedicated public health research officer who's helped us to develop research projects, including this one. So what we did with this survey is, unlike many other surveys that you might hear about where maybe a form goes online and then people are invited to take part, or maybe people are stopped on the street and asked to respond to questions. What we did was we took a scientific approach where we took a proper random sample of residential properties across the whole of Medway. And this is important because if you just rely on people filling in a questionnaire online, you're going to get biased responses. You're going to get certain groups of people who'd be more likely to fill in a form than other groups of people. And by taking a random sample, we're much more likely to get a true representation across the entire population. So that's the approach we've taken. In the report here, what we have is the questionnaire, so you can see the sorts of questions that we asked. There were many more things that we wanted to ask the people about, but that would have made the questionnaire far too long. So our initial questionnaire, where we put everything in that we were interested in, when we tried to fill it in ourselves, it took about an hour and a half, and there was just no way that would be feasible. So we had to be quite brutal and reduce the number of questions so that it could be completed within about 20 minutes. We then randomly selected households, approximately 6% from the entire population, so that's 6% but stratified or sampled at LSOA level. So an LSOA is approximately 1,600, 1,700 people. So for each of those 1,700 people, we took 6% of the residential properties in that area. We then wrote to them, invited them to take part in the survey online. We gave them 2 weeks, and then for those who had not responded, we wrote to them again and invited them to fill it in online, and then waited another 2 weeks. And after that second 2-week period, for those who had not responded, We then went out with a team of people, knocking on doors, up to 3 times at each household, to invite them to take part in the survey. And then we had a little follow-up exercise in areas where we had low response to knock on their doors a further time to try to just boost response. So this report explains that broad methodology and provides the initial just overview of the data that we've collected. And I must admit, I was extremely nervous about what the data would look like, because if we didn't get a good distributions of key by age, by sex, and by deprivation, if the distributions in the data did not look similar to what we know about the distributions in Medway, it would make it very difficult to come out with robust estimates for everything else that we're interested in. And I'm extremely happy with the distributions that I've shown you here in the report. So these tell me that all the analyses that we're going to be doing going forward will be robust analyses. They will be truly representative of the Medway population across the whole of Medway. It's going to take us a bit of time to analyze everything. There's a lot there. And I've got my team of people working on it over the next few months. But hopefully by sort of the autumn, we should be able to provide an initial report with key findings telling us about smoking prevalence in one part of Medway compared to another, telling us about feelings of well-being in one part compared to another, comparing different portions of the population by deprivation, by ethnicity, etc. So I'll stop there and invite questions.
Stuart, please.
Thank you, Chair. And I'm always impressed with the work that Dr. Whiting does in the area of data analysis and so on. And I think this comes into that list. Earlier part of my career was very much in the area of marketing, and we carried out, albeit for completely different purposes, huge surveys from time to time. And so I know what a task it is. Personally, I would be a very happy bunny with the raw data and playing about with it, but I'll leave that to the professionals to do, because it will take you some time. So well done, and I think it's very valuable, and I'm sure it's one of those gifts that will keep on giving as you get more into it and understand things. A couple of sort of questions. Will there be sort of comparisons with other data sources, such as the recent census and so on, which will also contain useful information, and there might be other sources? And secondly, I'm trying to bear in mind this would have been a very costly and time-consuming exercise. In your view, what sort of length of time will go past before you're thinking it's a little bit dated and we've got to run the exercise again to refresh that raw data? Thank you.
Okay, very good questions. So in terms of the refresh, or no, first of all, let's take the questions comparison with the census. Yes, in a way we're sort of lucky that we've had the census when we have, because the results from the census will start coming out this summer. I think sort of some of the more detailed local authority level data won't come out until a bit later in the year. But that will allow us to triangulate and compare what we have from the survey across other measures, so like ethnicity and other measures. We'll be able to compare those, what we have in our survey, with what was in the census. And that will allow us to adjust any weights for the analysis if we need to. So it comes at a very good time. Thinking about when to redo it, my original thinking was maybe after 5 years, because by then the population will have shifted a little bit, and it would be good to have an update. A lot of the work that we do relies on census estimates, so we go 10 years between estimates. So by having an update after 5 years, it will be very good. But I was having a conversation with James Williams just a week or so ago about this, and he was suggesting that possibly we might want to do it more frequently. We will need to look to see how rapidly we think some of the key items will change to see whether it is worth doing it more frequently than 5 years. But initially, my thinking would be no longer than 5 years.
Chair, but thank you so much for that answer. For what it's worth, my view, which is probably not worth a lot, is that 5 years is probably right, but for a refresh, and probably 10 years to coincide with the census to do the whole exercise completely again, because I've always been surprised at how the data actually holds for longer than people realise. But that would be a judgment for you in the course of time. Thank you.
Vince, please.
Thanks very much. One of my two questions was, when are you going to do it again? So that's helpful, and I agree broadly with I think the thinking is on that. I mean, this will be a very interesting set of data that will come forward. From a practical perspective, it's great that you've got the analysis here on a ward-by-ward basis. Those wards don't exist in less than a year's time. So is the plan... And I know super output areas go across wards, and actually in some cases super output areas are going back into wards rather than straddling, coincidentally. So that's a good thing. But is the plan to be able to flip the data so it sits into the new 24 wards? I hope the answer is yes. And then the follow-on to that would be, I guess, for the team looking after new members next year when they get elected, actually a bit of explanation. I'm sure there will be a general briefing on public health, but actually as a newly elected representative to hear, I think statistically reliable data because of the amount of people you've spoken to, both collectively but in the individual groups, would be incredibly powerful to say, actually, this is the thoughts and the opinions of the people you've now been elected to represent. So if some of that can be built in, that will probably be slightly further down the line if your hopeful timescale is the autumn, but it's around making it future-proof from a council perspective.
Yes. Oh. So, it's difficult to talk with that in. So the sample is actually taken at LSOA level, lower level super output area. So as I said, just 1,600 people. So in densely populated areas, that's actually quite small geographically. And wards are built up of LSOAs. So we presented summaries here by ward because we know elected members are interested in looking at the data by ward. But actually, sorry, but wards are irrelevant to me. We can cut the data however we wish geographically because we'll be able to stitch together the data from different LSOAs. And we're actually going to be applying some fairly advanced statistical approaches called Bayesian approaches, which allow us to sort of effectively borrow data from different areas to create robust estimates for small geographical areas. So we might even be able to provide sub-ward estimates.
Brilliant, thank you very much.
Gary, please.
Thank you, Chairman, and thank you for your report. I'm looking at 2.3 on page 50, where it starts halfway through the paragraph, so that it would be possible to provide robust estimates of adult obesity, smoking prevalence, etc., for areas within Medway, and this will enable us to determine where the need is greatest. Just picking the two examples you've given and not any others, if you identify the need is greatest on those two areas, what is it that you think you can actually do about it?
So this is about providing us with a better understanding of the population within Medway and where the areas are that have the more significant problems for things like smoking, adult obesity, etc. So that means we can then tailor our messages to those particular areas or change our services to support those areas. So for example, if we find an area of Medway that has a higher smoking prevalence, significantly higher smoking prevalence than other parts of Medway, and we don't have much in the way of smoking cessation, of our smoking cessation services in that area, we'll be able to reconfigure our services to provide better service to that area. So that's the sort of way that we'll be using the data.
Okay, I'm just asking the question simply because we've gone through this exercise many times over the years especially on those two, and we don't seem to be making any form of dent in it at all.
Well, smoking prevalence in Medway has dropped considerably over the last 10, 12 years. It's been on a steady decline. So we definitely are making progress.
Thank you for that, David. Yes, I would agree with David's comments with regard to smoking. We've made significant progress to the point that Medway was identified, but a couple of months ago we hosted a visit from senior people from government and the NHS who wanted to find out exactly how we were dealing with the problems in Medway and how we've been able to make such good progress, not only on smoking cessation, but equally on how we were dealing with the illicit tobacco trade that most towns and most areas around the whole country have to deal with. And they came down and they were taken out by 2 police officers, shown around Chatham and given the examples of what does really happen. And the strange thing is that as they walked along the high street, they went into one particular shop and the police officers noticed that things weren't quite right, and they summoned not only reinforcements to search the premises and found significant amounts of illicit tobacco, and it was immediately seized. But in addition, immigration were informed, and 2 people working in the shop premises were in fact taken away by the immigration service because it seems that their papers were not in order. So that was really 3 jobs that were shown, and the government minister who came down initially thought that perhaps this had been a staged raid on a shop, but it was shown to him that it was not staged at all. It just happened to be what was going on in Chatham at a certain area at that particular time. So we have a stop smoking group of people that are very, very active, very active. And the fact is that if we are aware of what goes on, then we're in a position to alter the focus in different areas around the towns. And that equally applies to obesity. And I've said this to some of you before, and that is that the obesity program that we have in Medway, particularly with regard to fast food outlets, where we do not permit any fast food outlets to be opened up within 400 metres of a school or educational facility. That was actually picked up by the Mayor of London, who all of a sudden, what we've been doing here in Medway for years, all of a sudden, because the Mayor of London picks it up, oh, this makes headlines in the Evening Standard. Sorry, Evening Standard and Mr. Mayor of London, you're about 5, 6, 7 years behind the time. So we got there first. So it's nice to know people, underhand compliments, I would suggest, that Medway is being picked out as, again, we're on a pedestal of doing best practice. Thank you. Adrian, please.
Yes, on the illicit tobacco, which is quite a challenge for us, and I think what the authorities call Operation Ignite has been really, really successful here, and it was good that there was a minister present to see that success. However, the problem is that these shops or premises have a closure order put on them, but it's only for a maximum of 60 days. So unfortunately what happens, they move premises. So they take all the bits and pieces out and have other, and they move from premises, so you've got to start again, which is a great shame. So whilst Chair is good to that, but I think it was excellent news that there was a minister present, because it's government that has got to change the law to make these closure orders more effective, because we've got a superb team, and the star member of that team is Yo-Yo, the sniffer dog, whose ability to sniff this stuff, and cash as well. He not only sniffed out the tobacco in one premises last year, he actually found a significant amount of the illicit gains as well as the illicit tobacco. So, I mean, yeah, the work we're doing in Medway, I think, is an exemplar, but the government needs to step up to the plate and make the penalties far more appropriate for what is a very significant crime, because it's just also, it's not the trouble with this illicit tobacco is it's not the fact it's tobacco, that's bad enough, but it's also it's the quality of the stuff is absolutely appalling. So, you know,
So you're not,
you know, it's not what it says on the label. You know, it's got proper brands on the label, but it's often not. It's come from sort of counterfeit factories and the like, and you know, and the health implications of that are absolutely appalling.
Thank you. There being no other speakers, I'll now move to the Vice Chairman, please.
Thank you very much. I think the important point of this survey really is the fact that it covers two angles, really. It covers not only where we need to put our resources, but also I think it's a very good indication where, as in areas like safety, sometimes GPs and so on, where perception does not match reality. And I think that's the other side of this, which we then can address with the aid of communications campaigns and so on. So there's a twin aspect to that. What is it actually like? Exactly what it is that we can do, because the risk, of course, is, I mean, we know we've got extremes in Medway. We have areas of extreme deprivation, and we've got areas of quite some affluence. And I think that it's very unfortunate and wrong, really, that those areas go on existing over a period of time without really more positive action to actually fix it. And I think this is the first stage in this. So I do welcome the report. Obviously, it's a preliminary stage, but I think it's going to be a very valuable tool in actually addressing where we need to put additional resources and to actually, I think, give us some force under the new system in actually banging Medway's drum to get those resources, because otherwise you'll never get them. So can I then move that we note the preliminary findings of the Picture of Medway survey, and I think that we have due regard to the other points that have been raised.
Thank you. Is that agreed? Agreed. Thank you all very much. Now, I have been advised that as Dame Elaine Sillis, in fact, has actually left the meeting, officially the meeting is no longer quorate. But I'm advised by Democratic Services that we can, in fact, continue, because the last part of the last item on the agenda, in fact, is the work programme. So we will now continue, and it's item 10 on the agenda, the work programme. And the report also outlines the proposed changes to the board's terms of reference pursuant to the establishment of the Chatham Medway Integrated Care Partnership Joint Committee. Over to you, please, Debbie, our Democratic Services Officer. Thank you.
Thank you, Chair. At the pre-agenda meeting, members agreed to defer 2 reports and add 1 report to the future meetings. The latest work program is set out in Appendix 1, and in Appendix 3, that's proposed revisions to the terms of reference and membership. The proposed changes mainly reflect the replacement of CCG by ICB with effect from 1st of July. Thank you.
Stuart, please.
Chairman, with your indulgence, I wonder if I could just, it's appropriate for me just to raise a point to seek guidance on whether this should be a part of this work programme or to be referred to an alternative committee to take forward in some way. It's a subject you and I discussed earlier about defibrillators. James Williams did some just completed some excellent work on understanding where they exist within Medway, and that of course shows up potentially where some gaps are and where we'd like more and how to market them, how do we keep that list up to date, on the basis that it's something which, although the NHS I know do look after, it would be good if our council sort of led particularly on that, because I think the access and use of defibrillators could save lives. In fact, a good friend of mine, his life was saved by one a few years ago, which is just one reason why I take a particular interest. I think possibly the way forward would be to go to another committee with its overview and scrutiny, or whether a task group of some sort could be set up to look at this and find the most appropriate way of taking forward what I believe intuitively is a very easy win in terms of health improvements for Medway people by properly understanding and encouraging access to defibrillators and giving advice to those very kindly organisations, some of which I know you, Chair, are involved with, who from time to time provide extra defibrillators. If we can provide support in that whole process, I think it would be an excellent thing for the health of Medway people. So my question is, how do we take that piece of work forward? Thank you.
Thank you. To be honest, Stuart, I'm not really sure of the answer to that, but what I can say is that I certainly recall when I was chairing adults overview and scrutiny, adult and health overview and scrutiny, which must be 2008 or 9. This in fact was raised then, and it's interesting how in that time we've moved so far forward. We've moved from back in those days that nobody was interested, nobody wanted to put anything up on the wall, nobody wanted to become involved. There was fears about levels of training, nobody could operate it until they were trained properly, etc., etc., etc. And here we are now, all that time on, and we're seeing defibrillators being placed in all manner of public places. And my colleague Adrian Galvin and myself last year saw a defibrillator actually installed in our ward in Waterslade Village. And actual feedback from the owner of the post office facility in Waterslade actually told me and confirmed that that defibrillator had been taken out of the box and used on at least 3 occasions. Now, that shows that they are good, they are purposeful, and as a ward councillor, I've contributed to the purchase of defibrillators in schools, in clubs, and on all manner of places, which is, as you say, it's an opportunity to spread the word, and every defibrillator has that opportunity of saving a life, and that is so, so important. But like you, I'm not quite sure whether it should go back to overview and scrutiny, or whether this is something that Health and Wellbeing should be picking up with a recommendation. Okay. Vince, please. Oh, sorry, did Democratic Services...
I think it'd be helpful to hear from Wayne on this, and certainly that there is something that has that data already, which I'm happy to share when I come in.
Yeah, in terms of the issue of defibrillators, Chairman, if I would suggest that we take this away today and come back to Health and Wellbeing Board, the next agenda planning meeting, to let you know what our thoughts are. Would that be acceptable, Councillor Tranter? Thank you. And also, just for the avoidance there, obviously we are in core rate now, so on this item, obviously we can kind of note the proposals, but obviously officers will take those away accordingly. Thank you.
Well, I think that's useful, Wayne, because James Williams, following an inquiry from Councillor Tranter, has in fact already picked it up and has done a significant amount of work. And having read the report through myself, I think it's a golden opportunity to expand on that. And certainly I would have thought if we can come back to the next meeting with a fuller programme and a fuller approach to what we need to do. Thank you. Gary, you wanted to come?
Yes, thank you, Chairman. We have a number of defibrillators within my ward, which we've either put in as ward councillors or the parish council. There is, in fact, an app site called HeartSafe if you need to find it, if you've got a smartphone that you can use to find the nearest location. Failing that, you can also phone 999, who will tell you the exact location nearest to you. The issue using a defibrillator is not training, because it tells you exactly on the box what to do. The issue that we have discovered as owners of defibrillators is making sure that they're maintained on a regular basis.
No, very valid point. Vince, you wanted to come back?
Yeah, it's a really important point, actually, because there's been some good coverage on this nationally recently, and of course we all think back to the Euros last year with Christian Eriksen, and that equipment kept him alive as well. So the place for people to look is the National Defibrillator Database, which is, for those looking in, nddb.uk. That will tell you where they are as well. There's other apps too. I'll be absolutely guided as to whether this, I think it could sit at either committee, but I think bringing something to a Medway Council committee to discuss this would be helpful. I agree with Gary on actually the big issue now is not using them, and I think there's a kind of collective confidence around that. Seeing it being used on BBC Breakfast is a good thing. I worked in partnership with Tracy Crouch to put one into Chatham Town Football Club. Hugely regrettably, that got vandalised. And that is part of the challenge as well. And you kind of look on and think, my goodness, if you've done that and then a relative of yours needs that piece of equipment, which is not cheap, people will know these are not cheap pieces of equipment. So I wholeheartedly endorse that and encourage people to look at the website. Just picking up on the point that was made in the first item around GPs, again, I'm conscious there is an item scheduled to come to November. We've had a further conversation today. We have also got the task group. So it does almost feel like potentially this is and I understand why, because it's such a high profile issue, but it does feel like it's almost becoming a standing agenda item. And I probably for the next pre-agenda, it may just be helpful just to understand the timeline for the task group and actually what would be brought forward if we had the report at the next meeting or if we waited 2 meetings' time as per the current work programme. I'd rather, if it takes a little bit longer to have a more detailed report, and if that is inclusive of the task group, that probably makes sense. But I think there's probably need for a lot of more conversation on that, and say happy to be part of that at the pre-agenda meeting.
Thank you very much. We do have Wayne Hemingway here this afternoon, and Wayne is more than happy to take members' questions on the Appendix 1 item, which is the ICP Joint Committee. If anybody has got any questions that he wishes to that you wish to raise, Wayne is here to answer your questions. Good. So, are we in agreement with the work programme? And here, really, could I pass to the Vice Chairman, please?
Okay, I think that I move that we agree to the work programme which is attached in Appendix 1, and to recommend the revisions, the terms of reference and membership as set out in Appendix 3 to the report, subject within that to the timing of the report regarding GP services. In other words, if it can, I think what would be useful actually would be to have a progress item next time. It'd be very short, just to let us know. Because what I don't want to be told is when I get to November, they haven't done it yet, because I'm getting fed up with waiting for it. Okay.
Yeah, I think we all share your concerns there. Meeting after meeting, promises have been made and they've not been kept, is the bottom line. So, thank you, Vice Chairman. Are we agreed? Agreed? Thank you very much. Well, that really does bring us to the end of the meeting now. That's it. Thank you all very much for your time, effort and energy this afternoon, and we'll see you all at the next meeting. Thank you.